Namaste and welcome to the next lecture of Clinical Ayurved by Dr. Mayuresh Agte. We will be discussing Annavasotas Vyadhi, and today we are going to discuss a very important, very commonly found disease, and which is called as Amlapitta. Before starting the discussion on Amlapitta, I want to make a point which is very important. In common people, there are a lot of misunderstandings about the word Amlapitta. I have seen the patients which come with the diagnosis that I have got Amlapitta and I want a treatment. But when you take the history or examine the patient, you will find that he is naming the word Amlapitta to anything right from Aruchi, Adman, Ajirna, Chardi, Amlapitta as a disease or any other GI tract disorder. This must be your experience also. That patient comes to your clinic and says, I have the problem of acidity. Now, when he says, I have the problem of acidity, just don't get biased and take the complete history, ask the patient which actually symptom he is suffering from and then history and other thing. Second other disease which is patient comes to you with the diagnosis about GI tract is you must have experienced this also, that I have got colitis, I have got amoebiasis. Now patient has heard this word on YouTube or WhatsApp or in common talking with the other people, and these three things, acidity, colitis, amoebiasis, are very commonly heard by the doctors in their clinic, and patient says I have these problems. Again, their understanding about this disease or meaning, they don't have no meaning every time, but they name it their symptoms in these three categories. So don't get biased with the diagnosis of the patient, go with the symptom and perfect history. So you will find that whether it is really Amlapitta or colitis or amoebiasis or any other thing. So today's topic is Amlapitta. When I am going to discuss this Amlapitta, I have some doubts in my mind regarding the description in the text and the clinical patients which we see in the practice. So, in the discussion of Amlapitta, you may find that I am asking you some questions which I have not found the answers till date. When Samprapti of Amlapitta is written in the text, it is very simple that Mithya Ahar Vihar, then Agnimandya. So because of Agnimandya there is Amotpatti, and everything which patient eats gets fermented and there is Amlodgar, etc. You know all these things. When we go deep in the Hetus of Amlapitta, you will find there are two different sets of Hetu. They have written Snigdahar as well as Rukshahar. They have written Abhishandi Guru as well as Tikshna Ushna Vidahi Anna Padartha. So, in the food products they have mentioned Ikshuras, Fani as well as Kulatha, which is Tikshna Ushna Dravya. So, you will find that there are some Hetus which are Tikshna Ushna Gunatmak, others Guru, Abhishandi, Drava Snigdha Gunatmak. Now, one set is Tikshna, Ushna, Rukshan, Annapan, other is Guru, Abhishandi, Snigdha, Annapan. Both totally different to each other properties of Hetu which are written in the Hetu of Amlapitta. Now, I had questions regarding these Hetu 7. What is the Samprapti? Samprapti is Agnimandya, Amotpatti, and then further fermentation, etc., etc., vidahitva, vidaddata. I will not go in detail, you know everything. Now say, for example, if a person is saving ushna viryatmak anna, for example, spicy food. Now, if the spicy food is ushna tishna and ruksha gunatmak, like lanka, how it will create agniman there? In the case, or in the, they have written as a kulatha. It is again ushna viryatmak dravya we use in amvat for ampachan. So, dravya like kulatha, how they will create a samprati of Agnimandir, Amapatti and fermentation? This is the question which I have thought of many times. So, any set of group in the Hetu, which is Tikshna, Ushna, Ruksha, all these are Agni Samana Guna. How they will create Agnimandir and further samprati will happen? This is the question which arises in my mind. This is in my mind for many years. The other set of Hetu, Guru, Abhishandi, Atidrava or Padartha like Ikshurasa, Fanita, okay, they are already Guru, Abhishandi which are Agni Viruddha Gunatmak and they are liable to produce Agnimandir and then they will create further Samprapti. But there is question in this Hetu also. Guru, Abhishandi, Snigdha, Atidrava or like Ikshuras, they will create Agnimandir, but these set of guna, if they are Shita Viryatmak like Ikshurasa, like Fanita, how Vidahitva will be created? When we are learning about Ajirana, there are types of Ajirana, and when there is this Kapha Pradhan Gunadharma which are against Agni, the Ajirana and their symptoms are totally different. So, if a person is taking Ikshurasa in more quantity, if it is taking some Guru Ahar, like any food, sweet food, etc., like in Diwali we have eaten all of us, they will create Agnimandir, but how that in that Agnimandir Vidahitva or burning sensation will be created if we are on the principle like Vruddhi Samani Sarvesha. There is no Ushna Guna in such dravyas. They are Guru Abhishandi and okay, sometimes if it has taken Dahi, we can understand that it is Ushna Abhishandi plus Ushna. But in the text, they have specially mentioned Ikshuras like Dravya. How if there is no presence of Ushna Virya or Ishna Guna in that specific Anna Padartha and they are only about Guru, Drava, Abhishandi, Snigdha Gunatma, then Agnimandir will happen. They will produce Udara Gaurav, they will produce some, say because of Dravaguna, a sensation of vomiting maybe, but Vidahitva, Vidaddata, how this property or symptom will be created by such typical hetus. So, I have put in front of you two questions. One, Tishna, Ushna, Gudamna Dravya like Kulatha, they will increase Agni and how they will be responsible for Agnimandir when they are Agni Saman. And Guru, Abhishandi, Snigdha, Hetu will create Agnimandir, but because of their properties, how Vidahitva or Ushna burning sensation etc. will be created. These two questions I have put in front of you and I will be happy to have your opinion on this. We will discuss Samprati of Amlapitta on the background of these two questions and some more points I will explore in front of you in the next lecture. Thank you very much.